We're live.
Right, shall I just wait for a few people to log in?
You're good to go, Councillor, whenever you want.
All right, okay. Right, good evening, everybody, and thank you to our first ever live water scheme meeting. This is just for Sparkbrook and Balsall Heath East only. So I just want to welcome you all. If anybody's got any questions or anything like that, pop it in the questions and I'll start taking questions down. Just before we start, just want to mention briefly about notice of recording. Chair is to advise that residents listening participate in the online meeting, that recording of the meeting will be available for future records. So we are live and everything is being recorded. And everybody can just mention any questions I've got. Justin Varley from Public Health, so he'll be speaking any minute. If anybody's got any questions, just type your question in and Justin will start taking it along as we go along. Right, thank you. So thank you, Justin, for you.
Great, thank you, Councillor, and apologies for keeping you nervously waiting. I've just come from a meeting from a group of Birmingham's African and Caribbean churches, which is part of the ongoing engagement we're doing. So what I thought tonight was I'd give you a short kind of summary of where we are on COVID. I'll talk a bit about testing, a bit about vaccines, and where we're going in terms of the second wave. But I'll also talk about the situation at the moment in terms of thresholds for escalation, because you will have seen on the news things like Leicester and Blackburn as well. So in terms of COVID first appeared in the world in December in China. We then saw our first case in the UK in February, and then the first case in Birmingham in around second week of March. We saw numbers increase in Birmingham quite rapidly, and we hit our peak around the middle of April when we had over 140 cases a day. And then we saw numbers slowly drop down. When we've come out of lockdown, we've started to see an increase in numbers again. And that has been reflected in probably about 20 to 25 cases, up to 30 a day. And they've been dotted all over the city. We have seen clusters of cases in different areas, and you can go on the government website, put in your postcode, and it will show you the cases for the last week in your particular area. I should say, I think next week, if you look, you'll see there'll have been a small rise in the number of cases in Sparkbrook, and that relates to a couple of households. So when I say a small number, it means you've gone from having 2 cases over a week to having, I think it's 7 cases. And that's split across 2 households. So it's not the end of the world numbers. So it is important to kind of just keep that in mind when you look at this website, because it's quite easy to look at it and go, oh, we've got a spike. And actually it's 1 or 2 houses. What we are seeing increasingly now is that the people who are testing positive are working age, predominantly between 20 and 40. And we're seeing most of the spread is happening at home. And between family groups. So unfortunately, we've seen in some areas where we've seen numbers rise up, and in 1 week, in one area, we had 21 cases in a single week, but that was 7 houses who were all from the same family, who at some point had come together during the week before and spread some love and some COVID with it. And they'd forgotten to keep the distance. They'd gone in for a handshake or a hug, and that's why the COVID had spread amongst the family. So that's very much the pattern we're seeing in Birmingham at the moment. We are seeing more cases at the moment in our Asian community than other communities, but it's difficult to explain whether that is because there's more COVID or because our Asian community is fantastic at getting tests when they've got symptoms. And that's because I don't yet have the ethnic breakdown of who's getting tested. I only have the ethnic breakdown of who tests positive. And we have done so much engagement with our Asian communities. I'm hoping that is a reflection that actually everyone's being very responsible and getting a test quickly when they have symptoms. So that leads me on to how you get a test. Well, there are 2 types of tests. The first test is the most important one. That's about testing, do you have COVID? And if you have symptoms, so you have a high temperature, you have a new cough, or you've lost your sense of smell or taste, then you ring 119, or you go on the NHS website and you order a test. It's important that you isolate and your household isolate from that point forward. So when you've got symptoms, that's when you need to isolate and stay at home. You can get a test either by having it sent to you through the post. That normally takes about a day to arrive to 2 days. If you drive a car or someone drives a car in the house that you live in, because it has to be driven by people that you live with, not by a neighbour, not by a friend, because otherwise you might infect them, then you can get an appointment at one of our drive-through sites. And you can often get an appointment on the same day at a drive-through site. And for us, the new site is now near Aston University, because the Edgbaston site has closed, unfortunately. The other option is a walk-through site. Now, I think Newtown's a little bit far to walk from Sparkbrook. So that's probably not an option for you at the moment, but we are looking at opening other walk-through sites around the city, because we know that a lot of citizens don't have cars. And if you go to a walk-through site, you can get a result. Your result normally comes within a day, whereas a postal kit, from the time you order it to the time you get a result, normally takes about 3 or 4 days. So it's a much faster way to get a result. If you test negative, so let's start with, if you test negative, then that's great. You can go out, everyone in your household can go out. It's not COVID, you're fine. If you test positive, you have to isolate at home for 10 days from when your symptoms started. And the people you live with have to isolate for 14 days from when your symptoms started. So that's the kind of time frame that you need to be. So 10 days from when your symptoms started if you're the one with symptoms, and 14 days for everyone else. Now, they've just changed the way of ordering tests. So you can order tests for your whole household at the same time. But if anyone in the house tests positive, then everyone has to stay in for the 14 days. Okay, does that make sense? Because I know that's one of the bits that people get confused about. So if anyone in the house is positive, it's 14 days for everyone else. But if you're negative, then and everyone else is negative, the whole house is testing, then you're fine to come out. The other test that you see in the media is an antibody test. So an antibody test is looking, have you had COVID? Normally that test is done 3 to 4 weeks minimum after you've had symptoms. Now we know about 1/3 of people who've definitely had COVID don't develop an antibody. Their body just doesn't grow it, doesn't learn how to defend itself. And that's because the COVID virus is the same family as the family of the common cold. And you don't generally develop defense mechanisms against the common cold, and you catch it again and again. And COVID-19 seems to behave a bit like that. Our body just doesn't know how to defend itself properly. So about 1/3 of people don't develop any antibodies. And then of the people that do develop antibodies, about 1/3 of them forget how to make them after about 2 months. So basically your body's forgotten how to make them. And even if you see COVID virus again, you don't know, you treat it as if it's completely new. So therefore the antibody test makes no difference to social distancing, to hand washing, if you work in healthcare, to personal protective equipment. It's purely at the moment for research and interest. So please, I would advise you don't waste your money on buying a private antibody test. It's not particularly useful. The other thing I should talk about is testing on people who want to go on holiday. If you need a COVID test because you're travelling to a country that requires it, you will have to pay for that yourself. The NHS does not pay for it. But for anyone who has symptoms or who is a contact of a case, you can get a test for free. So you only have to pay for it if it's for tourism, basically. And many different countries are doing different things. So do check the country you're going to understand the regulations. So that's the point on testing. Vaccination. So in terms of vaccine, I expect we won't have a vaccine that's available for everyone until 2021. And it will probably take us about 6 months to vaccinate everyone who needs it. So with a good wind, given all the research that's going on, I would expect us to see a vaccine being rolled out in the spring or summer of next year, if we're lucky. And that's because the vaccine trials have not just got to work out, does the vaccine create a response? Does it give you antibodies? It's also got to test, is it safe? Does it work in different age groups, different ethnicities of people? How long does it give you antibodies for? Because some vaccines we have to have 3 or 4 times before our body really learns how to do it. And some vaccines you have every year. So all of those things have to be gone through. And then when you find the right one, you've then got to make enough of it. And then we've got to work out how to give the injections to everyone who wants them. So it's quite a long journey. So I would expect us to be in this COVID state for at least another year. So that brings me on to the second wave. And we know so far about 20% of the population have had COVID. So that means 80% of us haven't had it yet, which means we will have a second wave. It's not if, it's when. And so what the focus we have at the moment now is on preparing people before the second wave to reduce the risk of them dying. And there are 6 risk factors that increase your chances of dying if you catch COVID. 3 you can't do anything about, 3 you can. So the 3 you can't change, no matter what the cosmetic industry tell you, is you cannot change your age. If you are over 70, particularly if you're over 80, your chances of dying if you catch COVID is much higher than someone who's aged 20 or 30. Your chances of dying are higher if you're a man, and your chances of dying are higher from your non-white ethnic group. So if you're white British, your chances are lower than any other ethnic group. So those 3 things you can't change. And the gender and the ethnicity reflect the distribution of the 3 things that you can change. So first is smoking. So if you're a smoker, I would really strongly advise you to give up or at least switch to vaping, because smoking is associated with more severe illness and death. If you've put on a little bit of extra weight during lockdown, as many of us have, then it's important to try and lose it, because being obese, being very fat, is associated with an increased risk of dying from COVID, particularly if your body mass index is over 40. The third thing that you can change is if you have a long-term condition. So there are 2 elements to this. First of all, having a long-term condition like diabetes, chronic heart disease, high blood pressure, kidney disease or chronic airways disease increases your chances of being very unwell with COVID or dying. But those chances are even greater if your disease is not well managed. So we know that some of the reason for the difference in ethnicity and COVID is because some communities, for example, our South Asian community, are more likely to have type 2 diabetes. But it's not just that they have more type 2 diabetes, it's also that it's less well looked after. And part of that's about what the NHS doesn't do, and part of it's about what we don't do for ourselves. So there will be a real push over the next 3 months on those 3 things. 1, helping people to get support to quit smoking, to lose weight, but also if you do have a disease like diabetes, your GP practice will be reaching out to you to see how they can support you to look after it better. Because if we can reduce those 3, then the number of people who die in the next wave will be much lower than it is currently. And it's important to remember we've lost in Birmingham over 1,500 people who've died to COVID. That's more, I understand, than the number of people who were killed in Birmingham during the Blitz bombing back in World War II. It's a much higher number that we lose every year to seasonal flu. So this has had a big impact on many families, and it's important to remember that this disease is no less deadly than it was a month ago, and it's only because we've been in lockdown that numbers have dropped. So it's what we all do over the next coming weeks and months that make a difference. And that brings me to the final bit about what does lockdown mean? What's local lockdown, and what are the kind of thinking at the moment? So you will have seen on the news areas like Leicester, Blackburn, Oldham and Greater Manchester have had increased interventions happening. So there are 3 levels to this. The first is areas of interest. And really you become an area of interest when you have more than about 20 cases per 100,000. Your positivity rate, so the percentage of your tests being done that are positive, starts to go up, and you have and you can't explain that because you haven't got a single factory, for example, where everyone's got infected. And that's an area of interest. And at that level, what you see is areas giving additional advice about not going to visit friends and family. More testing happens, more communication and awareness, really. Then you become an area of interest. So that was really at around 30 to 40 cases per 100,000. And that's an area like Blackburn, for example, where there's an additional advice, for example, to not go to mass gatherings, restrictions put on the number of people visiting each other's houses. But it's all in the context of guidance rather than legislation. The third level is areas of enhanced support. So that's an area like Leicester. And that's where you're seeing over 50 cases per 100,000. And in that situation, the council has talked to the Secretary of State, invoked the COVID Act and put in place the regulations which will force businesses to close. And that might mean closing all restaurants, pubs, might mean closing places of worship or schools. But it's dependent on the pattern of the outbreak. So they're the kind of 3 levels of escalation. And as a council, we're working with our partners at the moment to put in our levels of escalation, which are a little bit lower, so that we can try and avoid getting onto that list. And try to avoid the kind of national naughty step when it comes to COVID. Ultimately, what happens to reduce the spread of COVID is what we all each do in our own lives. You know, from the council, what I can do is put information out, and your councillors, your elected members have been supporting us in getting messages out to communities. We've been working with community radio stations like Unity FM, like New Star Radio. We've been working with faith leaders as well as community leaders to make sure everyone's got the messages to put out in multiple formats. We've translated many of those into over 15 languages as well. We've done WhatsApp. I've learned how to do Instagram Live, Facebook Live. This week I've done translated Q&A in Chinese. Last week I did it in British Sign Language. So we are trying every which way we can to give you the information to keep yourself safe, your family safe, and our city safe. But it's the things we each do, and that's about washing our hands regularly after we've touched anything that someone else will have touched, avoiding touching our face, keeping that 2 meters distance. And if we're going into a house or a building that we don't live in, like a temple or a church or a mosque, or we're going on public transport or in a taxi, then we're putting on that face covering. And that face covering has to cover from your nose to your chin. A visor doesn't work. It must be a fabric face covering. Then that's about keeping your germs close to you to protect the rest of the world from you. And the final thing we all need to do is, if we have symptoms, then get a test. The sooner you know whether it's COVID or not, the sooner you can take the right steps to protect you, your family, and our city. So I hope that's a reasonable coverage. I know I've covered a lot of information, but I hope I've given you some information that's useful tonight about how you can keep yourself safe, and also giving you a sense about where we're going in the COVID outbreak.
Thank you, Justin. There was a question from Naeem about the impact measures combating COVID-19 by the Support of Public Health in Sparkbrook, and give them examples regarding working with them communities.
Yeah, so for example, so what we've done is, in terms of working with geographical areas, we've done that through elected members. So your elected members get a weekly briefing from Councillor Hamilton, who's the cabinet member, which has all the data in it for the city. And alongside that, we've been sharing key messages to put out. What we've been encouraging members to do is do that in the format that works for them. So whether that's through WhatsApp group, text messages, individual conversations, it varies for different members about what works. Alongside that, We've been using community radio stations, as I said, particularly focusing on radio stations and local media that engages our ethnic communities. We've been doing a whole load of Q&As, as I said, the bilingual ones, for example. I've done a couple in Milpuri, which has been interesting. I've also done some with the Sikh TV channel. My personal language skills are awful, so they're always through translators. So it's always really interesting to have a conversation in English, then the presenters talk about it in a language I don't understand with the audience, who then ask questions in languages I don't speak, who then they come back to me and ask for a point of clarification on one small bit of a very long conversation. But it's just examples of kind of the ways we're trying to get out. And we've also been using things that the council doesn't normally use. So, for example, with young people, we've been using Instagram Live. So I've done several Instagram Live Q&A sessions with young people. We've done Facebook Lives as well. We're really trying every which way to get the message out. And we've been working with 9 community partners for specific communities. So, for example, the Chinese Community Centre with our Chinese community. And we're about to expand that further, so there'll be further tenders coming out to support that, as well as working with partners like our neighbourhood network schemes and some very specific groups. So I've done 2 sessions with our refugee and asylum seeker health champions, answering their questions, talking to them about COVID, to make sure that part of the community gets the messages as well. So that just gives you a flavour. I mean, I do on average about 12 hours a week of live Q&As like this with different communities in different formats. And sorry, I should have said throughout all of this, actually, we started even before lockdown. I've been meeting the mosques of the city and our temples and gurdwaras and our churches, but particularly the mosques, I've been meeting on a weekly basis. And it's only when we moved into July that dropped down to fortnightly, but working with them closely on festivals like Eid and Ashura to make sure that we're helping them give the right advice to the community and to make sure that also people can pray and worship in safety.
Thank you, Justin. I did put a question that if anybody's got any more questions for Justin, but I don't think we have any more questions for you. So thank you, Justin. You're more than welcome to stay, or you can log off. Thank you
very much for having me.
Thank you. Okay, the next item is Councillor's update. As you are aware, we normally have a joint tasking meeting with the local police, but because of technical issues, they can't join. So I'm not sure if they're going to be joining in as a guest. But Sergeant Chris Rigby did send me an update, which I will read to everybody. So if anyone's got any questions, well, I wanted to publish it, but I can't publish it. So I will be just quickly read it out to everyone what he has said. So currently, the priority for teams, the team relating to tackling violence offences and protecting vulnerable people. This week, in line of the force's priorities with work done to impact on drug dealing and in the area of targeting those involved, proactive operations have been conducted which are referred to below. However, the team are also involved in engaging with young persons linked to drugs and county lines and working closely with support officers where appropriate. The team have been proactive with number of search warrants excluded in the ward, where the team have also been assisted by other force departments. We have included drugs warrants in Sparkbrook, where a significant quantity of cannabis and cash was recovered and an occupant of the address arrested for drug offences with allegations ongoing. A search warrant was also carried out on commercial premises in Balsall Heath for several stolen vehicles recovered, as well as various vehicle parts. 2 people were arrested at the location and further arrests are anticipated. Officers were also involved in arrests of an offender of Ladypool Road for drugs and driving offences who were later charged. Other proactive operations have been carried out locally involving other force departments, which have resulted in arrest of offenders and the recovery of drugs and weapons. The team provided regular tweets, hope you've all seen them, and encouraged residents to follow the Sparkbrook team on Twitter and sign it to WM Now messaging services. So if you haven't, please do so. Sparkbrook is currently showing an increase in year-to-date crime, with total offences increasing by 2.24% from this time last year. There are also various crime categories, such as robbery, which has been reduced by 8.76 compared to last year, and reduction of vehicle theft. Domestic violence has also obviously been increased by 26.79%. Hate crime has also been increased by 14.2% against last year, and violence with injury under 25 has also increased by 9.3%. During COVID-2019, our community work have been impacted. However, over the past few weeks, we have been able to reintroduce our joint patrols with Birmingham City Council, civil enforcement teams, and been issuing tickets to vehicles causing parking offences along Ladypool Road. A number of tickets have been issued and vehicles have been moved on. We have started a new neighbourhood watch on Speedwell Road due to complaints from residents who are experiencing an increase of antisocial behaviour on the road. We now have residents signed up to the scheme, and signage has been put up on signposts along the road. We have also conducted joint patrols with our Street Watch member NAS as a way of offering a visible presence. We are hoping to recruit more Street Watch members in Sparkbrook, and we have recently met with them to discuss the future. Food banks have also been invaluable during this difficult time, and we have tried to make sure we link with the team when it is possible. We have food banks in Balsall Heath Church Centre, Balsall Trust, and St Mary's Church. Whilst patrols in open spaces have continued to conduct weapon sweeps and machetes, which have recently been recovered by the member of a public, have now been safely disposed of. We are aware of a number of complaints we have received with regards to begging on the junction of Watford Road and Stratford Road. This is being looked into, and warning notices will be issued to repeat offenders. We have also arranged joint patrols alongside other agencies that can offer support and advice. So that's the update from the police. If anyone's got any issues or questions, you can either email them to me or let them know, and I can let Sergeant know. So that was the update from the police. And I've got an update for you guys. Let me just find it. Right, just briefly updates. I'm hoping that you've all been following the Birmingham City Council website about COVID. Just a couple of updates. I'm not sure if you are aware that libraries have started to open up. So if you need to use the library, just check beforehand what time the libraries will be opening. Discretionary business grants, if we've got any businesses here, that the business grants, the grants are open up until 17th of August. You may be awarded up to £25,000. That does not need to be paid back. So if you are a business and you're struggling, please fill in the discretionary business grants. Something what Justin was saying about if you're not feeling well, you can do an online test, or you can either ring 119 to get tested if you have any symptoms of COVID. During this difficult time, mental health has increased a lot. So if you know, or if you are struggling, or if you know anybody who else is struggling, we've got a number which is 0121 303 5500, which is Birmingham Solihull Mental Health Foundation. For mental health. So if you need any support, that's the number, or in case, you can always just ring and let me know. I'm not sure if you are aware, on Ladypool Road we have some barriers put up. That's because obviously you are aware that Ladypool Road has very narrow pavements, so we've got barriers put up so we can maintain social distances and trying to keep everyone safe. Just a couple of other things. Hubs that we have in Sparkbrook, Balsall Heath, for any help. We've got a couple of hubs which are ACP Ashiana Community Project, which are available and willing to help and support people. We've got Balsall Trust, which the police have also mentioned. We've got St Paul's Trust, Moore Trust, Women CIC. So if anybody is struggling out there and need any help and support, either get in touch with hubs or get in touch with me, and we can support you in whatever way you need. And final point from me is I've received a proposed telecommunication, which is a 5G mast to be installed on Cartland Road in Sparkbrook. Obviously, I will be objecting this. So once I have received the application, I will either let you guys know so you can all put your comments in, and that's about it from me. So let me just check to see if there's any questions. Has anybody got any questions? Any questions? See any questions? Nope. And any other business? We've received one from Alex. I'm sure, has everybody read what Alex has wrote from Montgomery Street? Anyway, I'll read it if you haven't got it. This is from Alex, Montgomery Street Cooperative. I'm from Montgomery Street Cooperative. We are negotiating a sale of our business centre with Birmingham Property Services. Our business centre is the last remaining business start-up in the city. It is the community resource that Sparkbrook cannot afford to lose to developers. Its potential can be further unlocked to help start more local enterprises and facilities much needed training. Earlier this week, one of our units was broken into and a considerable amount of money was stolen along with some equipment. We have inadequate security because of the security gate hasn't been repaired for the past 5 years. We are trying to progress our negotiations with property services so we can make the situation with our security. We are, however, facing difficulties trying to get the virtual information out to the current management of asbestos containing materials on our site. Could you please support us in trying to prompt Birmingham Services to help us complete our survey on site? So that's from Alex. So can we support that? Right, do we have any other questions or anything that needs to be raised or any other businesses? We've got one from Paulette, which is the 5G mast, which I just mentioned earlier on. Oh, sorry, that's Parks and Libraries. Sorry, my apologies. Right, any other business or any other questions? Does anybody want to ask anything else? I'm not sure when the next ward meeting is going to be, but I will let everybody know in due course. Does anybody have any further questions before we finish for the day? No. Right, so thank you everybody, and I will be in touch when the next water scheme meeting will be. Thank you and good evening.